Imagine fighting a life-threatening cancer and knowing that your children might not be able to visit you when you need them most. For Matthew Venner, a 42-year-old father of two from Bromley, this could soon become a reality. Matthew was diagnosed with stage 4 non-Hodgkin lymphoma in December 2023, and for nearly 2 years, he's endured intense treatments, from chemotherapy to cutting-edge immunotherapy like CAR-T therapy. He currently receives care at the Princess Royal University Hospital, or PRUH, in Orpington, where the Chartwell Ward provides specialized inpatient hematology cancer treatment. But now, King's College Hospital NHS Foundation Trust plans to move these services 40 minutes away to King's College Hospital in Camberwell. For Matthew, who is severely immunocompromised, this journey isn't just inconvenient, it's dangerous, potentially life-threatening, and would prevent his children from visiting him regularly. Matthew's condition makes even routine travel risky. Because chemotherapy obliterates his immune system, he is highly vulnerable to infection. His doctors have warned him to avoid public transport entirely, as a simple cold or fever could have devastating consequences. If I get a temperature of 37.5 degrees Celsius, I have to get myself to A&E at the PRUH as soon as possible, he explains. Immediate intervention is critical. Tests must be conducted within hours, and IV antibiotics administered to prevent sepsis, which could be fatal. His experience with the drug nivolumab is a stark reminder of the stakes. During his first administration, he suffered a severe reaction and fever, requiring urgent treatment at PRUH's A&E before being transferred to the Chartwell Ward. He spent 6 days recovering, as his children were able to visit daily, providing him with emotional support that is crucial to his well-being. Moving services to Camberwell would make this impossible. King's College Hospital NHS Foundation Trust recently announced plans to consolidate hematology inpatient services at King's College Hospital in Camberwell. According to the trust, the goal is to improve care for patients accessing hematology inpatient services. However, Matthew believes the move is driven by cost-cutting rather than patient welfare. The transfer would force him and other patients to travel 40 minutes by car or public transport, a journey his doctors deem unsafe due to his compromised immune system. Matthew fears this change could endanger his life and leave him isolated from his children during critical periods of treatment or recovery. They haven't taken into any consideration the discomfort of that journey, he says. They don't know how much that is going to cost, or if it will even be in a safe, immune-friendly environment. For Matthew, proximity isn't just convenience. It's a matter of survival and family connection. One of Matthew's biggest concerns is the impact on his children, aged 8 and 12. While recovering at the PRUH's Chartwell Ward, his kids were able to visit daily after school, providing comfort and emotional support during intense treatment. If the services moved to Camberwell, that connection would be disrupted. The 40-minute journey would make daily visits impossible, leaving Matthew isolated during some of the most critical moments of his treatment. He explains, if they get told that they can't see Daddy until the weekend, that is really hard. If I get an infection, or if it comes to end-of-life care next year, which could happen quickly with lymphoma, I could be miles away from the support I need. For Matthew, the proposal isn't just about inconvenience. It directly affects his quality of life, safety, and ability to maintain close family bonds during a life-threatening illness. In response to the proposed move, Matthew has been actively campaigning to keep the specialized hematology inpatient services at PRUH. He has supported a petition urging the trust to reconsider, which has now garnered nearly 25,000 signatures. The petition highlights the importance of accessible, life-saving treatment close to home, particularly for immunocompromised patients like Matthew. Social media and local news outlets have amplified his story. Drawing attention to the potential risks of the move, Matthew emphasizes that the current system already provides equitable access to care, as patients who need highly specialized treatment are sometimes transferred to King's College Hospital. He argues that moving all patients there unnecessarily increases risk, stress, and distance from family, without improving overall care. The public response reflects a shared concern for patient safety and family access in life-threatening medical situations. Matthew's story underscores just how critical proximity to care can be. He recalls the first time he received nivolumab, a drug used in his treatment. The reaction left him with a high fever and in urgent need of specialized care. Thanks to PRUH's Chartwell ward, he was treated immediately, avoiding life-threatening complications. During his 6-day inpatient stay, his children could visit daily, providing essential emotional support. Matthew worries that this vital connection would be impossible if services moved to Camberwell, potentially leaving him isolated during moments of extreme vulnerability. Beyond the emotional toll, the journey itself is physically risky. With a compromised immune system, even brief exposure to crowds on public transport could trigger infections, complicating recovery and putting his life in jeopardy. The stakes for Matthew are clear. This isn't just about convenience. It's about survival. King's College Hospital NHS Foundation Trust has responded to concerns, emphasizing that the proposals are still in development and aimed at improving patient care. A spokesperson noted that some hematology patients already travel from Bromley to King's College Hospital for specialized treatments, and that Matthew's feedback, along with input from other patients and staff, will be considered. However, Matthew remains skeptical. He feels the Trust's claims of improving care are disingenuous and sees the move as a cost-cutting measure that prioritizes efficiency over patient safety. I know they are going to make it worse, and they have got the audacity and arrogance to say, "No, we are going to improve your care as a hematology patient." I'm afraid that's a lie. I'm incensed, he said. For Matthew and many supporters, the decision is not just administrative. It has immediate consequences for the lives of patients and their families. The debate over moving hematology inpatient services highlights a broader issue: the balance between healthcare efficiency and patient-centered care. For patients like Matthew, this decision could mean life-or-death consequences, as well as the loss of daily visits from his children during critical treatment. The petition supporting PRUH's specialized care has nearly 25,000 signatures, reflecting widespread concern among patients, families, and the community. Matthew's story is a powerful reminder that healthcare decisions affect real lives, not just budgets and logistics. As the Trust continues to develop its proposals, the voices of patients like Matthew will be crucial in shaping policies that prioritize safety, accessibility, and the emotional well-being of those undergoing life-saving treatment. For now, the community watches closely, hoping for a resolution that keeps care close to home.